My sense actually is that a lot of people in healthcare, and particularly healthcare IT, overestimate the extent to which patients want to constantly monitor their health. My sense is that there will always be a few people who are intensely interested in those things. My sense is it's not a huge portion of the population and not likely to get a lot bigger. I may be completely wrong about this, but my sense actually is that a lot of people in healthcare, and particularly healthcare IT, overestimate the extent to which patients want to constantly monitor their health. My patients all have HIV. I don't want them checking their CD4 count every day or even every week. It's not relevant, it's not helpful, they have lives to get on with. So the notion that even people with chronic disease would be obsessed with their sugar levels doesn't strike me as particularly feasible or even desirable. So for a healthy 26-year-old triathlete, marathoner, to want to monitor their heart rate 10 hours a day, that's your hobby, that's fine. My sense is we now have all these new tools and we haven't yet figured out how to use them in ways that are useful and practical. So this strikes me as kind of an interesting thing for some people. We're still struggling to try to figure out just how accurately do we need to know your blood pressure? How many times a day do we need to know it? And we now have all these wonderful new tools and technology, and in healthcare, as frankly in so many other areas, we sometimes have to rattle around for a while to figure out not just what you can do, but what you should do or what you want to do that can be useful. And it strikes me that our increasing capacity to do real-time, constant physiological monitoring is in that category of, gee, it's a neat thing to do. Now, where would it really be useful to go that far?